How does chemotherapy work for ependymoma brain tumors? Imagine a tiny army of drugs working inside the brain to fight cancer cells. Chemotherapy involves using medicines that target these fast-growing cells, trying to stop them from multiplying. But with ependymomas, these drugs are not the main treatment. Usually, doctors prefer to remove the tumor surgically first, then use radiation therapy to kill any remaining cancer cells. Chemotherapy is often considered when surgery or radiation can't fully get rid of the tumor, or if the tumor comes back after treatment. Ependymomas grow from cells lining the ventricles, which are fluid-filled spaces in the brain and spinal cord. Surgery aims to remove as much of the tumor as possible, which is very important for a better outlook. Radiation therapy is then used to control any leftover cancer cells, especially when complete removal isn't possible. Chemotherapy is generally reserved for specific situations, like very young children under the age of 12 months. These little patients often can't safely receive radiation right away, so chemotherapy can help delay it until they are older and stronger. In cases where the tumor recurs or progresses after initial treatments, chemotherapy might be tried. Some adults with recurrent ependymoma also receive chemotherapy, but responses can vary and are often limited. Common drugs used include temozolomide, which is an oral medication, and combinations of other agents like vincristine, cyclophosphamide, cisplatin, etoposide, procarbazine, and carboplatin. In children, some studies have shown that chemotherapy can help stabilize the disease or produce partial responses, especially when used before radiation. However, chemotherapy alone rarely cures ependymoma and is not usually the only treatment used. Chemotherapy works by attacking rapidly dividing cells, but ependymoma cells tend to be less responsive compared to other types of cancer. Because of this, its benefits are often limited and must be carefully weighed against possible side effects. It is usually part of a combined approach, working alongside surgery and radiation. The effectiveness of chemotherapy depends on factors like the patient's age, the tumor's grade, and whether the tumor has come back. Decisions about using chemotherapy should always be made by a team of specialists experienced in brain tumors. It is important to remember that surgery and radiation remains the primary treatments, with chemotherapy playing a supportive role in specific cases. Ongoing research is exploring new systemic therapies, but currently, chemotherapy is not considered a standard cure for ependymoma. Always consult with healthcare professionals to understand the best options for each individual situation.